Erica, and I'm one of the owners of Growing Generations. Today, I'm joined by Dr. Kathy Salari and Sunny English from our Surrogate Admissions team. And today, we're going to be having a conversation about the updated data from the CDC around vaccines for pregnant women. And then we'll talk a little bit about how that impacts women who are considering becoming a surrogate. Dr. Salari, do you mind giving us a quick introduction?
I am a maternal fetal medicine subspecialist. So that is a physician who has a subspecialty in high-risk obstetrics, both in terms of complications from the maternal side, as well as fetal complications of pregnancy.
And Sunny, could you give us a quick introduction?
Yes, I work in the surrogate admissions department here at Growing Generation. So I'm working with our incoming surrogates who are wanting to help a family before they are matched with intended parents. And then I help them along the screening process as well as the matching process.
Dr. Salari, I'd love to start by talking about the most recent data we've seen from the CDC. You may remember that when we filmed a little video about COVID and vaccines back in February 2021, a lot of the data was quite new and limited, and now there's some more information available. Could you summarize that for us and sort of translate it into layperson's terms?
Sure, I'd be happy to. So as you recall, early on in the pandemic, we had very limited information regarding the impact of COVID-19 on pregnancy. And I think that that's understandable given that pregnant women only account for about 1% of the adult population. So it did take some time before we had a lot of the data regarding the impact of COVID on pregnancy. But really, as of November 2020, the CDC published its relatively large cohort study on pregnant women who had been affected by COVID-19. And what they did is that they compared about 23,000 pregnant women who acquired COVID-19 during pregnancy and compared them to age-matched controls. And there were about 400,000 women in the control group. And what they found in this study was that pregnant women who were infected with COVID-19 during pregnancy had worse outcomes in regards to maternal and pregnancy related complications. So specifically, women who were pregnant at the time of their COVID infection had a 5 times higher rate of being hospitalized. They also had a 3 times higher rate of being admitted to an ICU, as well as a 3 times higher rate of being put on mechanical ventilation. Altogether, if you took pregnant women who were infected by COVID-19, they had a 70% increased chance for mortality compared to women who were not pregnant at the time, but also had COVID-19.
Great, thank you for that. And can you talk a little bit about whether there is any new data now that we have a large portion of the population who is vaccinated? Has there been any information about how women do who are vaccinated and who contract COVID-19 versus not vaccinated?
So I think the pregnancy data does reflect similar trends that we see in the regular adult population. So pregnant women who are vaccinated tend to acquire the infection less, and they tend to have less severe complications. If you look at our hospitalizations among pregnant women, they are largely among unvaccinated pregnant women who acquire COVID-19. So I think that while pregnant women are at increased risk, a lot of the trends that we see are very similar to the non-pregnant adult population.
Could you talk a little bit about vaccine safety and some of the information and statistics available around vaccine safety in women who are currently pregnant or women who plan on becoming pregnant?
Sure. I think vaccine safety is certainly very relevant when talking about COVID-19. Many women, I feel, are confused and conflicted about vaccination. And this is true even among women who have traditionally gotten vaccinated against the flu or other vaccines like MMR. I think it's a good time to sort of take a step back and just think about how vaccines work in general. All vaccines, whether it's live viral vaccines, which is one category of vaccines that we have out there, or protein-based vaccines, they all work by tricking the immune system into thinking there is something foreign invading your body. So our traditional vaccines like MMR, chickenpox vaccines, these were vaccines where they inject you with a small amount of the live virus, not enough to make you ill, but just enough to elicit an immune response out of you. And that immune response allows you to develop antibodies. Now, there are other categories of vaccines like the flu shot, which are protein-based shots. So usually the flu shot is a combination of different proteins from different strains that they think will be prevalent that year, and they put that in the vaccine, and then your body reacts against the protein to develop antibodies. Now, the COVID vaccine is I would say, a new category in regards to how it works, although the technology behind the vaccine is actually decades old. It's more a new application of a widely used vaccine. The way the COVID vaccine works is, I make an analogy that all of the cells in our body have DNA, and the DNA is the cookbook for how your body does all its various processes. The DNA is converted into another molecule called RNA, and RNA is really the code that the body understands and uses to make proteins. Now, when you look at viruses, viruses are either RNA-based viruses or DNA-based viruses. All a virus is a genetic molecule wrapped in protein. And what they do for the COVID vaccine is that they inject you with a segment of the RNA from COVID. And this segment actually codes for a protein that belongs on the outer shell of the virus. When they inject you with that locally, your cell machinery, which is used to reading RNA for its own cellular processes, reads this code as well and actually makes the protein that belongs to COVID. Once your body makes that protein, the body recognizes it as foreign and develops antibodies against that protein. So that's largely actually how the COVID-19 vaccine works. In the end product is still tricking your immune system into thinking there's a foreign protein around and then developing antibodies so that in the future, when you actually get exposed to the virus, you already have your army full of antibodies to go attack it. I do think that there are some concerns out there that I have heard expressed by women regarding the fact that it is injecting genetic material into the body. The important thing to know is that RNA is a very unstable molecule. Even the RNA that we make in our own body, is only present for a certain amount of time and then it disintegrates. And that's the same thing with the COVID vaccine. It does not incorporate into your own genetic material. It disintegrates after a period of time. And so it is really only there during the time period where your body's making the protein that belongs to COVID, and then it just goes away. So in regards to safety, there has been ample safety data, certainly among non-pregnant adults. We have vaccinated hundreds of millions of people. The rate of complications and adverse side effects are tremendously low. When we look at side effects, certainly folks have things like mild grade temperatures and body aches and sometimes headache, but these are generally things that last on average about a day and then you're over that. But when we talk about serious complications, things that would concern anybody who would sign up for a vaccine, those are exceedingly rare. And truthfully, if we were to scrutinize any one of our vaccines that we've had in the past, whether that be flu shot or MMR or varicella, all of them have such potential. There is truly no medication, no intervention out there that has a 0% chance of a side effect or an adverse event. Ultimately, when we make decisions about vaccination, what we're trying to do is weigh the pros and the cons. What is the benefit of getting vaccinated and what is the risk? What is the risk of me acquiring a COVID infection versus the risk of an adverse event from actually getting vaccinated? And the truth is, for even a young, healthy individual, the risk of acquiring the infection is a lot higher than the risk of an adverse event from the vaccine. So ultimately, I try to reassure women, particularly preconception, prior to pregnancy, that the vaccine is certainly very safe and highly recommended, This is the official recommendation from the CDC, as well as the American College of Obstetrics and Gynecologists and the Society of Maternal Fetal Medicine. The safety and efficacy of the vaccine has also been demonstrated among pregnant women as well. And that is, I would say, much more newer data that we've acquired over the last several months. So whether a woman is preconception, during pregnancy, postpartum, or lactating, so really the entire reproductive spectrum, the recommendation is that women proceed with vaccination.
Thanks for sharing all that. You know, one of the questions we hear from women who have concern about the vaccine and its safety is whether it could potentially cause fertility issues down the road. Could you speak to that a little bit?
Yeah, so I have heard many women express concerns about the potential impact of the COVID-19 vaccination on fertility. It is unclear to me where that was and where that initially came from. I do think that there were certainly blogs on the internet and things that were seen and posted on social media. There is no evidence to suggest that the vaccine impacts fertility in any way. In fact, the CDC has made that statement to make it quite clear that there's absolutely no evidence to suggest that the vaccine adversely affects fertility.
Dr. Salari, there's a lot of conversation around COVID vaccine boosters. Can you talk to us a little bit about how that is, how they're applying that to pregnant women or women who are planning to become pregnant?
Yes, I think the question about boosters in pregnancy is an important one, as it will be relevant for many women, as pregnancy is 9 months long. I think I would encourage any woman to speak with her healthcare provider, her obstetrical provider, regarding the appropriateness of the booster vaccine in regards to which booster would be appropriate for them and at what time interval. Certainly the safety of the booster would be no different than the vaccine, and it is my personal feeling that it ought to be offered in pregnancy, and I would recommend it to women. But at this time, I would encourage that women discuss the details of that with their obstetrical provider.
Great. Dr. Salari, sometimes we're asked by surrogate applicants who do not wish to be vaccinated whether a history of a COVID infection helps protect them against some of the increased risk that exists for pregnant women. Can you speak to that?
I think that's a very good question regarding the efficacy of naturally acquired COVID-19 infection in regards to its protection against future infection. The truth is that it is quite unreliable. The natural history of naturally acquired infection, we really don't know how long those antibodies last and how strong that antibody response is. What I would say with the vaccine is that it was largely tested in trials. And so we have much more familiarity with the efficacy of the vaccine. So the official recommendation by the CDC is that despite prior infection or naturally acquired COVID-19 infection, that all individuals, all adults proceed with vaccination, regardless of when the natural infection occurred and regardless of if there are present antibodies. So serologic testing to see that if you have antibodies present is also not recommended in regards to your decision-making for vaccine.
Dr. Salari shared some really great information with us about the impacts of a COVID infection on a pregnant woman, as well as the safety and efficacy of the COVID vaccine. But we understand that there are still folks out there who are just not ready or not comfortable with vaccination at this point. And so we want to talk a little bit about how we approach those situations in the surrogate admissions process and the matching process with intended parents. So Sunny has joined us so we can talk a little bit about that. Sunny, can you tell us what we're seeing in terms of intended parents who also have concerns about the vaccine? Are we able to match surrogates who prefer not to be vaccinated?
So if a surrogate does not wish to be vaccinated, yes, we can still match her in our program. We do see where those surrogates have a longer wait time for a match. And the reason for that is because we can only match them with a small percentage of our intended parents. The majority of our intended parents are asking for the surrogate that they work with to have the COVID vaccination. The goal of the pregnancy is for a healthy pregnancy. And for the intended parents, they're going to look at that as either a surrogate who's vaccinated, or there is the small percentage of intended parents who are comfortable if their surrogate is not vaccinated, as long as she's taking a lot of precautions throughout her day to protect herself and her family from the COVID-19. And then of that list of intended parents who are open to the surrogate not being vaccinated, we also have to look at the intended parent's doctor to make sure that the doctor is not requiring the surrogate to be vaccinated. So Erica, we are seeing a lot of fertility physicians that come to us and say that they are now requiring their surrogate to be vaccinated. This list is changing weekly as we get more data from the CDC and different approvals. Doctors are adjusting their requirements for their surrogates. So we have seen surrogates who are matched with intended parents go to medical screening, and they both are in agreement that she won't be vaccinated for COVID. And then the doctor will come back with an updated recommendation that before transfer, the surrogate get vaccinated. So it's something that everybody should think of coming into this process, as it can impact your timeline at any point.
Sunny, that's all great information. And I think one of the things you're really highlighting is, choosing to become a surrogate is optional, right? Like no one has to become a surrogate. And I think one of the things that we grapple with as an agency, that fertility physicians grapple with, and even intended parents, is making sure that they aren't asking or allowing a person to put themselves at unreasonable risk. And so I think that's why there's a lot of conversation around the importance of vaccine and protecting the women who put their hand up to help another family. And because we're sort of in this transitional period of where we're learning more and more, it's really important that people just kind of know that while it might be this way today, in 2 weeks, it could absolutely change. And so we just encourage everyone to really think about that. One other risk I do want to discuss a little bit is health insurance. So for our surrogates who don't have their own personal health insurance at the moment and who might be relying on their intended parents to purchase a specific surrogate maternity insurance, they should understand that that insurance policy does not cover treatment for COVID-19. So if the surrogate is pregnant, she contracts COVID-19, they will not cover those medical expenses. They will cover standard traditional pregnancy care. So that's something we'll discuss with each individual as they come into the program, but something we certainly want to make sure people are aware of before they are fully committed to the process. Sunny, can you talk to us a little bit about what the process is like for a surrogate who does not wish to be vaccinated, and talk to us about how that process may differ from a surrogate who is vaccinated?
Yes. So for our surrogates who do not wish to be vaccinated, the first thing we'll do is have them watch the video today to learn about the vaccine. From there, we do require that all surrogates have a one-on-one consult with Dr. Salari and make sure they're fully consented on the risks of pregnancy and the increased risks of COVID during pregnancy. And the last step for our unvaccinated surrogates is we're going to ask them to sign a consent waiver saying that they are fully consented and they do wish to proceed with a surrogacy journey, knowing the increased risks involved.